Now, let's talk about sterile gowning materials. Sterile gowning materials are generally donned on top of the non-sterile garments. They consist of coveralls, hood, goggles, boots, and a second layer of gloving. These materials are specially designed for bioprocessing and pharmaceutical manufacturing. They provide 100% skin coverage to contain potential shedding of skin or hair. The sterile gowning materials are folded, packaged, and pre-sterilized in a very specific manner. The sterility indicator is displayed on each individual package. You should check the sterility expiration date before you use the gowning materials to make sure all materials are within their expiry. It's important to understand some design features for sterile gowning, starting with a coverall. The unibody feature provides a single, fully enclosed design which provides a continuous barrier. This prevents the risk that's possible with two-piece construction where one part might disconnect from the other. Both the sleeves and pants have cuffing around the wrists and ankles, respectively. This is to secure any shedding of skin or hair inside the coverall and also to facilitate the donning of gloves or boots. Neither top nor bottom have pockets. Lastly, the unibody has a single zipper to provide a wide opening for donning the gown and a top closure to secure the top collar portion snug over the hood and neck area to reduce exposure to skin. These features are carefully designed to contain shedding of hair and skin that may carry microorganisms. The hood is designed to cover a majority of the head and neck to again minimize exposure to hair and skin. Remember that personnel enter the gowning room with a hairnet and possibly a beard cover in place. These remain on under the hood as a primary method of retaining the hair. The hood provides a second layer of containment. The hood covers the mouth, leaving a small opening for the area around the eyes and the top of the nose. Often, a surgical face mask is worn over the nose and mouth. This is positioned under the hood, so if one is worn, it's donned before the hood. The hood tucks into the coverall to ensure adequate overlap. The eyes and nose area are rich in microorganisms that are easily expelled into the environment. Goggles are designed to limit the exposure of these areas to the environment. They should be large enough to ensure that the open zone of the hood, or the open area between the surgical mask and the hood, is covered side to side and top to bottom. Goggles should also be large enough to comfortably fit over personal prescription eyewear. The boots are designed to cover the junction between cuff and ankle, but they're commonly extended as high as the knee. They're designed to ensure comfort fit around the calf and to stay in position for a prolonged period. Lastly, the sterile gloves have many purposes. The main feature of these gloves is the length, which is typically longer than non-sterile gloves. The extra length enables sterile gloves to sufficiently cover the junction between cuff and wrist, or between cuff and sterile sleeves if they're used. These are some tips that help to minimize any potential transfer of contamination during the process of donning sterile garments. It's important to have gloves on, both during the initial gowning steps and during all subsequent donning of sterile materials, which makes it easier to sanitize frequently throughout the process. The outer surfaces of all packaging must be sanitized prior to handling. Gloved hands should be sanitized after opening any packaging, after each step of gowning, as well as after gown adjustments. It's especially important to pay attention to portions of the gown that have the potential to expose skin. For example, the sleeve to cuff junction must be adequately covered with sterile gloving to ensure full coverage. Also, the hood to eye junction must be fully covered by the goggles. Lastly, when placing coverall on, be sure to use only the thumbs to wrap the garment around the back portion of the body. This reduces the total number of touch points between your hands and the garment. When zipping the coverall, you can cross the legs and use only the thumb and forefinger of a single hand to zipper up the garment. Keep in mind that the less you touch the garment, the better. Finally, let's talk about how to remove gowning. This is often referred to as degowning or doffing. From a sterility perspective, the degowning process is usually less critical than the donning methods. However, there might be materials on the gown that must be contained. These could be drug substance or various biohazards. In this case, your organization may have stricter, more specific guidelines for degowning. In general, the overall concept of degowning is a reverse of the gowning process. Begin by removing the first layer of gloves to ensure that any product exposure is not transferred to the uniform. Next, loosen and remove your goggles. Then, remove your boots, making sure to unsnap any closures that were required for donning. Continue with removing your coverall and hood, making sure to loosen any straps or fasteners. Disposable gowning materials may require disinfection before disposal. Check your local procedures for disposal of these materials. Place reusable gowning materials in the appropriate bins, bags, or other receptacles for laundering and sanitization. Be sure to report any tears or rips that may have compromised the gowning materials. There may be a separate location to place materials that have been damaged. When removing the sterile gowning, be careful not to displace underlying garments, such as hairnets, beard covers, or shoe covers, unless instructed to do so by local procedure. These may need to stay in place if you need to traverse other controlled areas before making a final exit of the entire classified area.